biomedicine from the University of Mogi das Cruzes. Sorry for my Spanish pronunciation. Sao Paulo. He has done his specialization in anti-aging medicine from Seville University, Spain. He completed his Master of Science in Molecular and Cellular Immunology and Biology, and Master of Science in Clinical Advanced Nutrition. He did his PhD in Biomedicine and Immunology. He is the coordinator of Orthomolecular Medicine of Regenera Research Group for Aging Intervention. He is the professor and director of the graduation program in Orthomolecular Therapy, CESP University, Portugal. He is the scientific advisor for nutraceuticals and cell therapy companies in Europe.
Thank you. Thank you. Good morning. Hi. Hello. My name is Roni. Actually, I'm coming from Brazil. I'm naturally from São Paulo, living in Portugal, and I'm very glad to be here in Germany after 13 years that I've been living here in Germany also. So it's a very good thing for me to come back to Germany after 13 years. Thank you for receiving me. I'm going to speak about the brain nutrition and some that we can do to enhance the neuroplasticity to our patients, okay? So, let's begin with this kind of definition. What is neuroplasticity? So, the brain has ability to reorganize. This is a very interesting thing, because 15 years ago, when a student of mine asked me, Roni, could the neurons regenerate? I would answer them, no. That there is no possibility that the neuron can reorganize or regenerate. And now we know that. We know for sure that they can reorganize and form new neural connection throughout all life. So independently of age, we can enhance our neuroplasticity. So, what is in the articles the definition, actually definition of neuroplasticity? So first, the brain can have neurogenesis, which is the born of new neurons, not just reorganization, but new neurons have been born every day. So synaptogenesis, new synaptics, and cortical reorganization, mainly after brain injury. So after a trauma, a person with time can reorganize all the brain to adapt and mainly have the same skills as before. Depending on the grade of the trauma, we can reorganize the brain in the terms of regenerate completely. So, the glia is the immunity of the brain. And the glia and the neurons, they are connected to all of the inflammatory diseases. And with the neuroplasticity, they can adapt to stress and aging, mainly from the oxidative stress, DNA repair and regeneration. So with the glia and neurons, we can have a lot of factors that can enhance the repairing of the DNA. And you can release the neurotrophins, mainly the BDNF, the factor derived from the brain, the neurotrophic factor derived from the brain. So here we understand that we can have new brain connections. And how can we help our patients, nutritionally speaking, to have this neuroplasticity in the best position ever? First, with the Mediterranean diet. We have here in Europe a lot of research on the Mediterranean diet and physical exercise. They both together or individually can reduce the risk of Alzheimer's in 15 years. We know that Parkinson, Alzheimer's, neurodegenerative disease, they begin 30 years before the symptoms, due to DNA destructions, mutations, oxidative stress, whatever, but we can know today that 30 years before a patient started to have neurodegeneration. And if he eats Mediterranean diet or do a good physical exercise, I can speak about that afterwards, they can prevent a little bit or at least slow a little bit the appearance of the disease. So, Another article here is speaking about the adherence of the Mediterranean diet and healthy status. This is a meta-analysis. This is a very important research. 13% at least of Parkinson and Alzheimer's. This is the conclusion by the Mediterranean diet. So this is a fact. We can make our patients better, neurological speaking, and afterwards, in other terms of organic, heart, kidney, and so on, by doing just Mediterranean diet as a basis. Afterwards, what you can find in the Mediterranean diet that is very important for the brain. First, we have the connection here that you can see, the dietary restriction. So, first I spoke about the Mediterranean diet. Now I change to dietary restriction. Okay, let's organize a little bit the idea. Dietary restrictions is less calorie, not quality. So if a person has Mediterranean diet and with the caloric restriction, not eating so much every time, we can, by the oxidative stress, moderate oxidative stress from the dietary restriction, enhance the antioxidant capacity. So if you do a very moderate stress, your body can enhance the enzymatic antioxidants substances that can fight a little bit against the stress and enhance your neuroplasticity capacity. And afterwards, with the physical exercise, the same thing, moderate stress and adaptation to the oxidative stress, and mental exercise. Those three together can activate all the kinases, which will enhance the capacity of neurogenesis, mainly from the activation of the BDNF, the neurotrophic factors, and the precursors of the BDNF and other trophic factors. So, this is a very important thing to know. You just have to eat not too much and make a Mediterranean diet, do very good exercise, and have a mental exercise. Every time that you learn music, for example, or mathematics, or another language, you are enhancing your brain capacity to neuroplasticity. Do exactly from the same terms that you can see here, genetic activation of the BDNF and so on. So afterwards, you can see here from the hippocampus and the connection with the hypothalamus, for example, the activation of the BDNF from the dietary restriction, physical exercise, and mental exercise. The BDNF will activate all the transcription factors that will activate also the serotoninergic genes and activate the serotonin to do all again the BDNF production. The antidepressants are here just to enhance, optimize a little bit the production of serotonin, but this is just on the depressive patients. Normal patients don't need that, they just need that. This is the most important thing here. Let's advance a little bit with the brain nutrition studies, okay? So here, we see here at this study that the BDNF increased by, of course, what I said before, caloric restriction. Another article speaking and saying the same thing. What is the BDNF? And with the caloric restriction, the metabolic agent on brain plasticity, okay? So on, we saw from the Paleolithic age, I'm not fan of the Paleolithic diet, restricted speaking. I'm fan of a very good and individualized diet for every person. But here, the studies on the Paleolithic diet says very, very interesting things. Here, when they ate giraffes and elephants and so on, they ate a lot of fat, polyunsaturated fat, unsaturated fat. Those could enhance a little bit, develop a little bit the brain, as you can see here. So the quantity of the DHA and the AA, the omega-3 and omega-6, can organize a little bit better the neuroplasticity, as you can see here. And as you see here, you notice that the countries that has less consumption of omega-3, omega-6, have more depression tendency. As you can see here, the countries and the consumption of omega-3 and so on. And here is the development of the brain during the ages due to just omega-3 and omega-6 consumption, nothing else. So you can here understand the connection between the exercise, you can see here, and the DHA consumption. Here, at this graphic, you understand the activation of the BDNF, sympathetic plasticity, and the spatial learning ability. So, with the DHA and DHA plus exercise, you can have much more than just with nothing, just with the control comparing. And here, you have the factor of hypoxia, which is the oxidative stress activating factor. So, if you are under hypoxia, that is bad because you are under stress, and do just exercise, good exercise, you adapt your body to produce antioxidants. So you enhance your capability of neuroplasticity and also learning spatial ability. So, here you have the connection between the cognition and the intestine. Everybody speaks now about the intestine. It's very important that the 80% of the immunity is there. You have a lot of hormones producing there, and this connection is very important. But the consumption, the quantity of food that the person has to consume depend very much on the neuroplasticity, or the neuroplasticity depends on the consumption of the food. If you eat a lot, you will produce so many hormones here that you break down all your receptors, and nothing else will happen unless the obesity and stupidity. For sure, because yes, it's stupidity. Everybody that if you see people that just eat sugar, and they are very fat and they don't do any exercise, and you test the IQ level, those persons have very hard time to have good capability of mathematics, music, learning languages, and so on. So here you see that if you eat properly, restrictedly, and you do exercise, you activate your mitochondria. By activating the mitochondria, you enhance the BDNF and you enhance the neuroplasticity. If you eat a lot and you don't do any exercise, or very poor exercise, you will enhance the oxidative stress, but not the moderate one. The moderate one is the good one. The excessive oxidative stress is the bad one. If you don't eat properly, or eat too much, or don't eat at least, and you don't do any exercise, or you do just exercise all the time, you will activate more stress. And this stress is so bad that will inhibit the plasticity, as you see here. But if you eat properly and do properly exercise, you activate the chromatin, the SIRT. Here is this transcriptor factor for longevity, for example. And then with that, you will regulate epigenetically your body to activate the cognition. This is interesting idea that I'm giving to you. And if we connect to nutrition, you can pick up the omega-3, for example, DHA. And the omega-3 can just recover the membrane of the neuron. Elasticity of the membrane also depends on the omega-3, and also the activation of the metabolic energy from the mitochondria, which is very important for detoxification and also to regulate the oxidative stress, giving you energy and defenses. So that is the omega-3, and also inside the cells, by signaling, you will enhance the BDNF just by consume a lot of omega-3. So here is the studies. The DHA is a key component of neuronal membranes at sites of signal transduction at the synapses. So you have a lot of the things that I've spoken already, support the synaptic membrane fluidity, elevate levels of BDNF, reduce oxidative stress, and regulate cell signaling. This is the conclusion of the omega-3. And there are some studies, mainly the summary of the studies is that if you have an injury or a trauma in your brain and you consume afterward a lot of omega-3, you have more possibility to, by neuroplasticity, adapt and become better, or at least not so bad as normally you see from the traumatic people. Now, the sleep-wake cycle, that is very important. The circadian cycle is very interesting, mainly because in the Paleolithic time, we used to walk a lot, and we slept when it was night, and we were awake when it was light. But now it's not more like that, it's like that, okay? We are all the time below the artificial light, and this is the problematic thing, not just because of the circadian time, but also from the vitamin D. And we know now that the vitamin D is a problem here in Europe because we have the best consumption here by the equator. We live here and here. If you have sun and you don't go to the sun, you have a problem. But if you go to the sun and live here, you have a problem already. The same thing. I live in Portugal. Portugal is sunny all the time. We are in 19 degrees today. Okay? So every day is sunny, beach, everybody is happy. But the problem is, you don't go 1 hour every day to the beach. There is no time for that. If you are employed, that's not so common now in Europe, but if you are employed, you have to work. You are not on the beach all the time. So this is the problem here. A lot of my patients have deficiency on vitamin D, and independently of age. And what the vitamin D does in the brain, mainly regulates the immunity. And the studies are in multiple sclerosis patients, where we can see the high percentage of MS patients have low plasma level of vitamin D. And a decreasement of the demyelinization. That is interesting, not by the MS just, but all the neurodegenerative problems that have the demyelinization as a basis of the disease. So we have here less microbial activation, what means less immunity. Here they studied a lot of single nucleotide polymorphisms, 276 in 21 genes. And they conclude that the interaction between genes and vitamin D may affect the clinical course of MS. So there are a lot of studies on that, multiple sclerosis and vitamin D, and this is a very interesting table with a lot of nutrients that can enhance neuroplasticity. I will speak about some afterwards, but there are curcumins, flavonoids, vitamins, and so on. So here we have another article, and what this article says is that dietary polyphenols, another thing that we can find in Mediterranean diet, positive effects on cognition, treatment of brain diseases and injury. They studied there in the mouse and also in people, and they saw that the polyphenols can really enhance the neuroplasticity by the BDNF activation. So the dietary polyphenols can activate neuronal signaling. They are antioxidant and anti-inflammatory agents, as you already know. And the curcumin, I think there is some speaker that we want to speak about curcumin today or tomorrow. It's a very important nutrient. It's an antioxidant, anti-inflammatory, anti-amyloidal. Parkinson's and Alzheimer's, they have a lot of studies on those diseases with curcumin. And it's right that can improve the cognition function, mainly in Alzheimer here. 3 weeks before or after traumatic brain injury, they saw that the less consequences of injury on synaptic plasticity markers and cognitive function tasks. So, the green tea, epigallocatechin galate. So, reduction in cognitive deterioration in aging. Reverse degenerative effects of aging in hippocampus, enhancing memory. So, prevent memory loss and DNA oxidative damage. Here, you can see also that the preservation of the cholinergic function is a very important thing, mainly in Alzheimer's patients, but also in schizophrenia or other dementias or also depression. So, they can protect the blood-brain barrier, permeability, after brain ischemia, for example. Now, let's see what happens here. You give green tea to a person, and then you decrease the oxidative stress. By decreasing the oxidative stress, you activate the glutathione, you activate the catalase, all those are antioxidants, enzymatic antioxidants, you reduce protein oxidation, which is very important for Alzheimer, that has a tau protein that is oxidated and then deposited on the brain. And you can diminish the lipid peroxidation. Even if you have high cholesterol, that doesn't depend on that. The problem here in the patients that have high cholesterol is the oxidized cholesterol, not the total cholesterol. So this, with the green tea, can become better also. So if you see here until the end, you see that if you have green tea, you activate the CREB, transcription factor for the BDNF, and also you can regulate the apoptosis by the BCL2. And afterwards, you have synaptic plasticity, neurite of growth, neurogenesis, and so on. Now here, you can see also what resveratrol does. So, protects brain, heart, and kidney. Now, that we know already, okay, I understand that we have to take more or less 10 liters of wine to have a good consumption of resveratrol. So let's be drunk tonight, okay? To have a good brain plasticity. The resveratrol here can increase the apoptose, reduce tumors growth, is a strong anti-aging capacity because it can activate all the factors against Alzheimer's disease. They have a mechanism of neuroprotection that I will show to you here. So here you have a lot of stress from aging and from the neurodegenerative disease, but with the consumption of resveratrol, you activate the third one, that is the transcription factor for longevity, antioxidant capacity also. So if you activate that, you will have a best possibility to grow old, and without any neurodegeneration, or at least slowly a little bit in the neurodegeneration. So this is the way of the resveratrol working, and also here as an antioxidant. So let's speak about other neuroprotections like tryptophan, phenylalanine, tyrosine, dimethylglycine, some A. Those are all cofactors for the production of neurotransmitters. So you can see here tryptophan with the C vitamin, zinc, B vitamins can convert to 5-HTP and then afterwards to serotonin, and this serotonin with the use of omega-3 can activate noradrenaline, tyrosine, phenylalanine, dopamine, and so on. And also this cycle goes in this way also. From the phenylalanine, you can change to tyrosine, to dopamine, and with the help of the omega-3, those noradrenaline can activate the serotonin, and so on, so on, so on. You can see here the same thing. So you have proteins, you have B vitamins, zinc, copper, iron, manganese, so on, activate tyrosine, dopamine, noradrenaline, and adrenaline. So the conclusion is, you have to pay attention on the nutrition, because the nutrition can change a life of a person that or is older, or have neurodegeneration, or have possibilities to the neurodegeneration. For example, if you ask a patient, your mom or your father, do they have some neurodegenerative problems? Well, my grandmother had Alzheimer's, so pay attention and start now. Now I want to talk a little bit at the end from the bioidentical hormonal replacement. Okay, I do anti-aging medicine. I work a lot with my patients with bioidentical hormones. Bioidentical hormones come from natural sources, but they are hormones. Okay, but not synthetic hormones, natural hormones. This does all the difference on the patients. So the estrogens. If you activate the estrogens receptors on the patients, naturally speaking, you can reduce the depression, fatigue, lack of libido, poor memory, and all that you can see here. Normally, the doctors just pay attention on the hot flushes after menopause, but I don't do that. I pay attention in every detail of the cognition. So the estrogens can very much enhance the memory and concentration in every patient that for example, claims that they are depressed. Roni, I'm so depressed. I don't want to live anymore. I don't have a purpose on my life. Okay, so do just two things. First, natural estrogens, and second, sex. Then you can be happy and live longer. Afterwards, you can see here that the estrogens improves memory in women, visual memory in men,
hysteric memory in male rats, memory in patients with Alzheimer, better performance in intelligent tests, and protects a woman against Alzheimer's disease. Here you have the progesterone. Progesterone is a precursor of GABA. So it's an anxiolytic product, okay? If you give a little bit of progesterone in the night, the person will have less anxiety, and all the consequences of the anxiety will be at least controlled or modulated. So here you can see here that the progesterone is analgesic, sedative, and convulsive, anxiolytic, because it stimulates the GABA receptors. The testosterone, very important also, not just for the libido, because everybody connects the testosterone to the libido. I don't connect that just for the libido, I connect for the memory. It's very important to give power, to give energy. And here you can see that can also work with the blood clots, the thrombosis, and the HDL level. So the testosterone enhances the good cholesterol and diminish the clot possibility, the thrombosis possibility in the brain. Here you can see here that the dendrites and synaptic neuroplasticity will be increased in quantity by the use of testosterone. Testosterone so improves learning and memory, hysteric memory, mathematic performance in a woman. I don't know why they were so prejudiced here, but well, they did here the analysis. And in woman, the fluent speech is also better after the testosterone application. You can see here that 77% of men in andropausa complain of depression. They have low testosterone. That is the thing. Everybody now go to the doctor, and the doctor gives them antidepressants. If you give hormonal, if you have a proper nutrition, if you have exercise, maybe you can take 50% or more of those patients under drugs. You can take off the drugs of those patients. Now, melatonin, very important for the circadian cycle, and also connected to Alzheimer and dementia here. And with the deficient, you see person with more depression and also anxiety. Melatonin is an anti-inflammatory. It's a very important modulator of the inflammation, and also very important for the multiple sclerosis patients. There are studies in Spain with 100 milligrams of melatonin to modulate inflammation in multiple sclerosis patients. So here you see also the mechanisms. The mechanisms here is the glutamate effect, dopaminergic effect, and noradrenergic effect. Here, melatonin increases activity on parasympathetic nervous systems, is a sedative effect of benzodiazepine, and the amount of receptors in the cerebral cortex. Enhance the receptors, activate neuroplasticity, and is a very important inflammation modulator. Finally, the DHA, very known today for beauty, but also are connected. The DHA is connected to depression, and with a person with deficiency of DHA will have more depression. Imagine testosterone, estrogens, progesterones, DHA. Everybody that goes after andropausa and menopausa will need that. This is why they are so old, feeling old, not old in age, but feeling old, feeling down all the time. Here you have some studies, and here you can see that the mechanisms of the DHA can activate the neurotransmitters in the brain and have more sensitivity on the people after 54 years old. Here you can see the connection with the multiple sclerosis also. And then we go to pregnenolone, which is the mother of the hormones. After cholesterol, you have pregnenolone. After pregnenolone, you have DHA. After DHA, you have estrogens, testosterone, and so on. So the pregnenolone is connected to Alzheimer's, mainly with the Alzheimer's and memory. Okay. Afterwards, the final hormone is thyroid. In Portugal and Spain and Italy, where I work also, I see a lot of people with hypothyroidism and Hashimoto. So now this is a main thing today in the medicine, And if you substitute, if you replace naturally the thyroid hormones for to the people that are in needing, you can have this kind of outcomes in the brain. Better memory, better blood supply, better thickness of the myelin sheath, that is very important for multiple sclerosis, for example, and also reduction of the consequence of of the brain mass and Alzheimer's disease and Parkinson's and so on. So, finally, the last thing that I would like to speak is about the cell therapy. There are some treatments today done by cell therapy. Can be from human cells, can be from animal cells, can be from vegetable cells. I will focus just on the animal cells because the labs here in Germany and Switzerland, they are very fancy on producing cells from animals. Those are very important for that. Those are fresh frozen cell extracts just used in clinical medicine, okay? Those animals are certified and those cells have a lot of growth factors and nutrients, mainly the BDNF. If you pick up the brain cells from the sheep or from the pig or from the rabbit, there inside you will find a lot of BDNF. And if you apply to a patient, this BDNF can be released and activate all the transcription factors to enhance a little bit more the neuroplasticity. This is a possibility, very important one. And I would see here from the sheep and rabbit growth factors, hormones, peptides, and nutrients. I would search, for example, I would pick up the CNS cells, spinal cord cells, hypothalamus, hypophysis, and fetal. This is stem cells from embryonic stem cells, okay? If I pick up this kind of cocktail and I give to a patient, adding all the other nutrients that I spoke, I can enhance very much the possibility to revitalize the patient and make them become better neurological and also abroad speaking, okay? So, independent of age, be happy, eat very few but very well, and have sex, eat chocolate and drink wine. This is my advice to you, okay? Thank you. If you want to speak with me, there is my contact there. This is cacao, okay? In Brazil. No questions?
I didn't understand really what you mean by cell therapy because we know that several cells can produce some factors, but there are different type of use of this, either by transplanting directly the cells, but this is really very uncontrolled and you have to be very careful about that. Or you can also sometimes apply the medium that was produced by these cells and then apply this on tissue.
Thank you very much for your question, very important question. Those cells, they are produced just for human treatment. They are produced in laboratories in Germany for clinical purpose. Those cells are extracted with all the nutrients and they are certified for the nutrients to be there. So we know exactly what cell is there, what nutrients we have there, what minerals you have there, hormones and so on. And those cells are properly or taken by sublingual administration or intramuscular administration, depending on the weight of the Daltons and so on. The concentration of the nutrients are also researched by with people that have a lot of pathologies. Those nutrients, the main thing is that once you inject those cells, those nutrients are released from the cells. And we know how much nutrients are released. But we cannot, for sure, we cannot, never, this is perfect, never understand how much of those nutrients will enhance the activity of what we want. This is empiric, but this is a very important study for now and can be a cutting-edge treatment for the future. But today we can have those treatments in Switzerland, Germany, and abroad in Europe and America and Mexico, and they are doing for revitalization, and they have very important conclusions on their research, I assure you.
Thank you for your presentation of happiness. There is a very strict special population which has also malnutrition and brain decline and significant cognitive malperformance. This is the chronic renal failure patient, my dialysis patients. And if you will give them the extract of cells, rabbit or what else, they would not can rid of the excess of phosphor and kalium that they have.
Yeah,
so
that's what
we must adjust every kit, every neurological nutrition kit to this special population, which are the examples of brain decline.
Yeah, right, thank you. Right, depending on the population that you are treating, first you have to assure that they have the proper nutrients. This is the basis, the nutrients. And after you have all that you can, by nutrients speaking, hormones speaking, and everything, then you can maybe optimize a little bit what you are doing by treating them with cells, orally or injectally. This is not the main treatment. This is why I put in the last thing. This is a complement, this is an integrative treatment to enhance the capability of the patients. For example, I have people that are in poor memory. They are not dementia, they don't have any dementia, but they are in poor memory. I do all the nutrients, I do all the things that I want to do, give hormones, and then at the ultimate treatment, I ask them, do you like to treat with the cells and see if this is better for you? Some patients, preventively speaking, will do that. Other patients, for example, lateral sclerosis, this is a very, very complicated disease. There is no treatment for that. So that would be a very important patients to try something, because you can slow a little bit the inflammation, mainly the inflammation, you're speaking about that.
Nothing to lose, of course.
Yes, you have nothing to lose, and you have everything to gain. This is the main thing. Thank you. Thank you all. Bye-bye. See you tomorrow.
Thank you, Dr. Roni, for a great presentation. And it's time for workshop. I'm honored to invite Dr. Diana V. Artain. She's a nutritionist and dietitian with a master's degree in nutrition science and PhD in oncology nutrition. She is a certified member of the International Society of Sports Nutrition and a reviewer for the American Society for Nutrition. She has written 3 nutrition books. The Old Chocolate Diet sounds interesting, the Nutrition Diet for Moms, and 5 Years Diet. She works as an oncology nutritionist in Romania, Bucharest.
Hi, thank you. I realize I'm sitting between you and lunch. I will try to have this talk as short as possible. But still, I want to start with a question. How many of you actually work with patients in a clinical settings? Okay, thank you so much. I will present oncology nutrition from a clinical setting point of view, working with the patient one-on-one daily, and this is not a compromise, but sometimes I have to have the science, the scientific literature, what they say and what the patient can do, and I will show you the results of that union. And the first thing I want to say, if this works, is that most of our patients, when they have the diagnosis